Doctor, what is your name and describe your work, please?
Okay, I'm Dr. Anicet. I'm a medical doctor with 15 years of experience in reproductive health. I worked for 10 years in family planning program, especially as a family planning and HIV integration advisor at the Ministry of Health and also at Rwanda Biomedical Center until 2018.
Okay.
Since November 2018, I'm working now as independent consultant in reproductive health. And I do training and mentorship for healthcare providers. I do research. I do radio programs on reproductive health. And also, I'm writing some booklet on sexual reproductive health and rights.
Wow.
And also, I continue to work on family planning through the family planning tech working group, and also supporting some local NGOs. Now I am sometimes working as a senior technical advisor for especially a measure action of men engaged for action of men engaged on gender equality in Rwanda. And also I'm working for some local NGOs promoting reproductive health and maternal and child health, like Rwanda Women's Network and the Rwanda Health Initiative for Youth and Women. That's my work.
Wow, that is such a powerful CV. I mean, you've achieved a lot in the family planning world. And that would lead me to my next question. What would you say is the status of family planning in Rwanda?
So family planning in Rwanda is a big program because you know Rwanda has a big population, even if it is a small country. And then family planning is advancing well when we consider the past 15 years where the contraceptive prevalence rate in Rwanda increased from 10 to 48%, respectively in 2005 and 2015. So when it comes to the men engaged, the use of vasectomy in Rwanda is still very low, because the statistics from the Rwanda National Institute of Statistics show us that the use of vasectomy is at 0.2%. But since the introduction of the new technique of no-scalpel vasectomy with Vicoteri, the demand of vasectomy services is increasing countrywide, with sometimes special high demand in some districts, especially in the north and in the west. And now we have in the country more than 5,000 men who did vasectomy since 2010. So it is still low, but we are advancing.
Yeah. And so while you advance and you grow the program, what would you say are the biggest obstacles you are facing?
Yeah, we have some obstacles and some big challenges in our vasectomy program. The big challenge is the vasectomy program in Rwanda is facing a high staff turnover among medical doctors, especially qualified and trained medical doctors. And they are moving between public and private health facilities. And some of them are working for non-government organizations and then not involved in clinical services. So the second challenge is about the access to service. Because we know vasectomy is mostly performed in public health facilities, but the access to service in the private clinics is still very low due to the cost of the service, because when you go to the private clinics, you have to pay for the service. So it seems that for people living far from hospitals, public hospitals, and also for the poor families, sometimes it is not easy to get vasectomy service due to the lack of access in the private sector.
Okay. And I think this is just a follow-up. And why do you think that, why would you want to get involved, or why do you continue to get engaged and involved in World Vasectomy Day?
So you see, I'm a family planning expert. And since a long time, I'm working on family planning, and also I had perhaps a chance to work at the ministry level, and also I was coordinating a family planning program, especially working on permanent methods of family planning, vasectomy, tubal ligation at ministry level. And since that, I was very well involved in a vasectomy program in Rwanda. And at that time, I started to participate in a celebration of World Vasectomy Day. Mostly it was organized jointly with UNFPA and the Ministry of Health. And now since 2018, I was now closer to Jonathan and Michel Abrek during the International Conference on Family Planning in November 2018 in Kigali. And I have the chance to know many experts in vasectomy and World Vasectomy Day team and the other super vasectomists in the world. That I see since that time. I'm totally interested and also impressed to see how World Vasectomy Day International is advancing vasectomy services globally. And I hope that we can advance together, we can move together, and also to ensure that in our African countries, we can make vasectomy an available service to every man and every client asking vasectomy from everywhere.
No, I really agree with that. And what are the most common reasons men give for not getting a vasectomy?
Yeah, I think getting vasectomy is somehow balanced by the traditional and some religious beliefs. I know men are still reluctant to use vasectomy due to different reasons, especially in our sub-Saharan countries, where perhaps some men think that vasectomy is not good, and some of them are taking vasectomy in a negative side. But in addition to this, ignorance is perhaps the most important reason which generates myths and misconceptions about vasectomy, and perhaps let men be fear of vasectomy, and perhaps are not using vasectomy as we want. So I think we have perhaps to take this in considerations, and perhaps to see how we can advance vasectomy with the participation of the community members, especially men and women at the household level.
Okay, Dr. Anicet. So on to that point, what do you think we should be doing to reach more men?
So I think from now we can perhaps see how we can mobilize and reach men perhaps near their villages. And the most important strategy is to put in place a consistent community education on gender, on men engage, on positive masculinity, on family planning for men. So to focus on especially the rural areas where people experience a limitation to information and to education. At the other hand, also, I think we have to put more effort on capacity building. So we have to train enough medical doctors from both public and private health facilities to ensure that we can avail and improve the access to vasectomy services. So also we have policy to create some innovative strategies. We can see how policy to reach women through the existing platforms at the community level, during community events, community meetings. Perhaps we can see how to reach men in football fan clubs. Perhaps there, men are there. In bars, we can go, perhaps where we can get men, and then we can provide them information to ensure that our men are exposed to accurate information on vasectomy, showing the benefits of using vasectomy, and also fighting those rumors and misconceptions around vasectomy.
Okay. And how has COVID impacted this effort of engaging men?
Yeah, this is a very, very interesting scenario because we know in general COVID-19 pandemic impacted negatively on the use of reproductive health services in general and specifically family planning. So when we consider the use of family planning for men, so the use of vasectomy was totally affected due to the shortage of doctors in place, and those few doctors were also concentrated on COVID-19 care and prevention. So that reason why I know that during and after the lockdown period, it was not easy to get an appointment for vasectomy in many countries, including Rwanda. So the impact of COVID-19 pandemic is still there, and currently people are trying to work under COVID, to live with it. Reason why now we are preparing the celebration of World Vasectomy Day, and some activities are now implemented in different health facilities, and especially in Rwanda, with the effort done on COVID-19, now people can have perhaps enough time to avail family planning services in health facilities, and some doctors now can have time to provide vasectomy services for men in need. So in conclusion, COVID pandemic is still there, but we have to work with it. And also, we have also to continue to mobilize people just by creating demand on vasectomy use. That reason why we are now mobilizing our population through radio programs, through community event, and other activities already implemented in different districts at the community level and in health facilities, to ensure that we can tell men vasectomy services are still there. hospitals are open to provide the services, and also doctors and the healthcare providers are available to provide the vasectomy for people in need. That is the reason why I salute very much the contribution from the World Vasectomy Day International, and also to thank all the team joining the celebration of World Vasectomy Day this month, this year, worldwide. Thank you very much.
Thank you so much, Dr. Anicet. This is really insightful to what Rwanda has been doing, and then just especially you as an individual, what you've been doing to promote male engagement in family planning conversations. So thank you so much for joining me
You're
and
welcome.
talking about this. All right, thank you.